everyone. Thank you for joining us today. We're going to explore one of the most important systematic connections in dentistry, the link between periodontal disease and diabetes. This relationship has a major impact on patients' health and on the way we practice oral health. Oral health doesn't exist in isolation. It directly ties to systematic health. By the end of this presentation, I hope you'll see just how critical our role is in bridging the gap between dentistry and medical. These are our main goals for today. First, we'll break down what periodontal disease is and what diabetes is, and how the two are connected. Then we'll review both traditional and emerged treatments, plus patient education strategies. Finally, we'll look ahead to future directions in both technology and integration care. Think of this as both a refresher and an update, something you can use in everyday clinical practice. What is periodontal disease? Periodontal disease is more than just bleeding gums. It's a chronic inflammatory condition that destroys the soft tissue and bones supporting the teeth. Left untreated, it can cause both tooth loss. What especially concerns is that the inflammation in the mouth doesn't stay local, it can spread systematically, making other health conditions worsen. What is diabetes? Diabetes is one of the fastest growing chronic diseases worldwide. It occurs when body cannot properly regulate blood sugar. We mainly see type 1, type 2, and gestational diabetes. Beyond sugar levels, it affects almost every organ system, increasing the risk of heart disease, kidney failure, and blindness. Importantly for us, diabetes also slows healing and lowers immune defense, making oral infections harder to control. The bidirectional relationship. Here are some fun about this is interesting. Diabetes making periodontal disease more likely and more severe. On the other hand, periodontal disease making diabetes harder to control and raising systematic inflammation. This two-way street is why we call it a bidirectional relationship. If one way, if there's two-way street, it is one condition is uncontrollable, the other tends to worsen it too. Here's some fun facts, but it's most importantly facts. If someone has uncontrolled diabetes, they're about 3 times more likely to develop severe gum disease. Treating periodontal disease can actually lower ABA1C by almost 0.5%. This is the same effect you'll get from adding another medication. That's huge. No wonder periodontal disease is often called the sixth complication of diabetes.
How diabetes affect gum. Patients with diabetes face unique oral challenges. Elevated blood sugar level impair white blood cells, making it harder for the body to fight bacteria. This means gum infections are more likely and healing after treatment take longer. The end result, more inflammation, more destruction of tissue, and more progression of periodontals. How periodontitis affect diabetes? The reverse is also true. The bacteria in periodontitis don't just stay in the mouth. They release toxins that enter the bloodstream. This stimulates the immune system, which increase level of cytokines like IL-6 and TNF-alpha. This chemical interfere with insulin function, leading the insulin resistant. Over time, this makes blood sugar even harder to control. The vicious cycle. Here is a cycle in simple terms. Uncontrolled diabetes lead to worse gum disease. Gum disease increase inflammation. Inflammation worsen diabetes. And the loop goes on. Breaking the cycle through treatment and prevention is critical for long-term health. Prevalence and statistic. Statistics highlight how common the problem is. About half of all diabetes patients suffer from significant periodontal disease. That's millions of people worldwide. On top of that, untreated gum disease in diabetic increase risk of other life-threatening complications like heart disease and kidney disease.
Advances in treatment. Let's talk treatment. Scaling and root planing is still the gold standard. It reduces bacterial load significantly. But newer tools like laser therapy and minimally invasive surgical approaches give us more options, especially for diabetic patients who heal slowly. Local antimicrobials can also target bacteria directly in periodontal pockets. Emerging therapies. We are also seeing innovative therapies. Host modulation therapy doesn't just kill bacteria, it reduces harmful inflammation. Probiotics are being explored to rebalance the oral microbiome. And imagine this chairside HbA1c testing. Dentists may soon be able to monitor blood sugar right in the dental office. Screening and diagnosis. Dentists are in great position to help detect and diagnose diabetes. If a patient has gum breakdown that doesn't match their oral hygiene, it could be an early sign of diabetes. Some clinics are piloting HbA1c or saliva testing right in the chair, helping patients get medical referrals sooner. Patient education may be the most powerful tool we have. Teaching patients how their daily oral hygiene habits and diet impact not just their teeth, but also their blood sugar can motivate change. Regular follow-up visits are essential to monitor progress.
Future technologies. The future is exciting. Artificial intelligence could help us predict which patients are most at risk the gum disease. Saliva tests may soon measure blood sugar and inflammatory markers painlessly, and teledentistry can allow us to check on patients remotely, making care more accessible. Personalized and integrated care. We're moving toward personalized, integrated healthcare. Genetic testing and lifestyle assessment can help tailor treatment. Collaboration with diabetes specialists ensure better outcomes, and shared electronic health records can keep all providers in the loop. Clinical tips for professionals. For us as dental professionals, here are some key tips. Always check the patient's blood sugar or HbA1c status before surgical procedures. Use minimally invasive treatments whenever possible. Reinforce oral hygiene at every visit, and don't hesitate to collaborate with the patient's physician. An example of a case study. This is a real-world example. A 55-year-old with poorly controlled diabetes presented with moderate periodontitis. After scaling, root planning, and oral hygiene instructions, his HbA1c dropped by 0.5% in just 3 months. This shows how dental care can truly improve systemic health.
Main question. So the main question, does treating gum disease really improve diabetes over outcome? The evidence says yes. Clinical studies constantly show HbA1c reductions of 0.4 to 0.6%, the same as adding another drug to a patient's regimen. That's why our work matters far beyond the mouth. Here we have a video of summarizing the link between periodontitis and diabetes.
Periodontitis is inflammation of the gums and supporting structures of the teeth. If untreated, it causes tooth loss. Did you know that periodontitis and diabetes are closely linked? People with periodontitis are more likely to develop diabetes, and vice versa. Diabetes increases the prevalence, progression, and severity of periodontitis, and periodontitis influences blood sugar control in diabetes. The good news is that periodontitis is easy to diagnose and control. Keep the following tips in mind. To prevent gum disease, seek advice from your dental care professional twice a year. Early treatment of periodontitis may reduce the risk of prediabetes. If you suffer from diabetes, share your diabetes medical history with your dentist. Watch your weight. Eat healthily and don't smoke. Control your diabetes. Reduce stress and practice physical activity. Brush your teeth twice a day. Clean in between the teeth every day. Use interdental brushes or floss. Remember, periodontal therapy is safe and effective. Take care of your gums. Control diabetes.
So this was our presentation. Once again, this is by me, Isra, Christine, Jacqueline, and Karine. I hope you guys learned a lot today, and these are the references that we used if you need to know more information. And have a great day. Thank you so much.